Hi friends, welcome back to my channel. Once again I am here with another informative video. Today I am going to discuss about the common doubts in OET writing. The first one is, let's start from the upper part, from the beginning itself. The first doubt is, where should we write the date? The answer is, you can write either at the beginning or after the address. It doesn't matter. And which format you have to use. For example, 10/06/2020 or 10 June 2020. It depends upon you. It doesn't matter whichever format you use. If you follow one format, if you are using the first format, just try to follow that one in the whole letter. That is the main and important thing. Then the second question when we goes to the address. If the name is mentioned, you can write the name of the reader. Always write the capital letter at the beginning of their first name and the second name. And suppose if the name is not given, what you have to write? Sometimes they are asking to write the letter to the director of nursing, like that. So always try to write the director of nursing, and make sure that also the first letters should be capital. That means T of the, then director, the D, of, O, and nursing, N. All should be capital. Then write the address. Then regarding the salutation. If the name is given, you can write dear, then the second name. And don't forget to put comma. And if the name is not mentioned, they are asking to write to the registrar, emergency department, like that means we know the registrar is a doctor. So what we can write? Dear doctor, then comma. Or to the community health nurse. Then we can write dear nurse, comma. And just suppose if you are writing to the director of refuge shelter, like that. So we don't know whether it is a male or female person and who is that one. So what we can write? The other option is dear sir or madam. That no need to write or, just put slash madam. Then don't forget to write the comma. Then next we will move on to the reference part. R, capital R, then small e, then the column, full column. It should not be semicolon. Then the patient's full name, and don't forget to write the salutation, Mr. or Mrs. And sometimes they put it as tricky. The name looks like male name, but later it is mentioned that husband is 50 years old, like that. So we can understand the patient is female. Okay. So if there is any gender change, you can lose your mark and your grade can be downgraded to C. So be careful when you are writing the gender. Okay. I think it's clear for you until now. Then, so we have written the name, then just put comma. If the age is mentioned, you can write age, comma, age 72, like that. Otherwise, if it is date of birth, we can write DOB, then full colon, then the date of birth. Which format you followed, just follow that same format. Okay. There are different way we can write the age. It doesn't matter whatever you write. Okay. And if the name age is not mentioned, only the date of birth has given, no need to calculate the age. in OET writing. You can just write the date of birth. Okay. I think you can follow me. You are able to follow me. Okay. So let's move on to the introduction. Until that one we finish. So in the introduction we are writing, I am writing to introduce. This letter is being written to introduce, like that different format we can use. So in that one, what we are at your service or from your service, how we can write that one. At your service means when we are referring one person to another facility, like that, another rehab center, community health center, like that, the patient is going there, that time you can write, we are requesting so and so care from at your service. Okay. Then what is the difference between from your service? We are requesting some person like physiotherapist, social worker to come and visit the patient and provide care. So in that time, the person is going to patient. At your service, the patient is going to that person or facility. Next confusion in the introduction part is was diagnosed or has been diagnosed. When we can use was diagnosed? When we are mentioning about some short-term disease like conjunctivitis or pneumonia, that time we can use she was diagnosed with conjunctivitis because it's already treated. So upon discharge, the action is it was completely cured. So for example, Mr. X was diagnosed with the conjunctivitis and treated with antibiotics. It's already completed. So we can use diagnosed. Then regarding has been diagnosed, the condition, it is a long-term disease. It even though the condition can be treated, it's not yet recovered. Upon discharge, still she has these symptoms and we are treating. It's continuing process, so it's a long-term disease. So we will use has been diagnosed in that case. For the short-term disease such as conjunctivitis and pneumonia, like that, we are using was diagnosed. So the introduction part has been completed. So next we move on to the first paragraph. Usually we are writing Mr. X was admitted to hospital or presented to hospital. It is a common doubt among the OET aspirants. So when we are using percentage, usually we use percentage if any discharge date or admission date is not mentioned, or in the hospitalization time, or there are several different visits mentions. At that time we can use she presented with complaints, like that. Never use was presented because she is coming herself, nobody was brought her, like that. So we are not using passive form in the with the presented. So Mr. John presented due to fever, diarrhea, like that we can use. Okay, I think it's clear for you. Then next is with the complaints or with the complaints. With the complaints, when there are several complaints like fever, headache, nausea and vomiting, like that. And with the complaint means a specific complaint like heartburn, fatigue. But the new update they are telling both are correct. We can use with the several complaints, with the complaints or with the complaints. So no need to be worried about that. Then next is underwent or has undergone. So when we should use underwent and has undergone. So regarding underwent, if there is a specific date mentioned, we can use underwent. And has undergone means there is no date mentioned and it has happened recently, like that we can mention that has undergone. For example, Mr. John underwent the surgery on 11th October 2008. Or we can tell Mr. Alex has undergone a cardiac surgery in which two stents were inserted. I think it's clear for you now. Then next is following or followed by. So when we are using following, the meaning of following is after or as a result. Here we are mentioning what is the action which happened at first. If we are mentioning two things and we are mentioning the first action we are using. With one example I will explain. So Mr. John fractured his elbow following a fall at home. So the action which was happened at first is the fall. Then only the fracture was happened. I think it's clear for you. So that means Mr. John fractured his elbow after a fall, or as a result of fall it was happened. I think it's clear for you. Then what regarding this followed by, this is the action which happened after something like that. It is indicated that comes after something else. The second action, when there are two things happen, the second action we are mentioning by followed by. For example, Mr. X has undergone surgery followed by chemotherapy and radiation therapy. In this case, the first process is the surgery which happened at first. Then only they started the chemotherapy and radiation therapy. So I think it's clear for you. Then let's move on to the second paragraph where we are mentioning about the treatment. We can see there Mr. X was commenced on, or he has been commenced on. When we are using this was commenced on, or you can see amoxicillin injection was commenced on him. So in that case, if the treatment has started in the hospital and it is completed from there itself, no need to continue in the future means we will use was commenced on. It has already completed the action. Okay. Then regarding this has been commenced on. So the treatment, it has to be continued even after discharge, and sometimes the patient may be diabetic or hypertensive. He has to continue his long-term medication, isn't it? So we can mention he has been commenced on. And if in the recommendation it is mentioned which needs to be continued like that, so no need to write it again. If we have mentioned like that, he has been commenced on in the early paragraphs, so it's clear for them it should be continued. Okay. Then in the social history, we are reaching to the social history or medical history. We are mentioning usually patient has had diabetes since 2009. That is, we are mentioning is he has, and it will not be cured. So it's a continuing process and it's not a curable disease. No, so since long time, it's a long-term disease. So we can use that he has had this disease since there should be a specific period, a specific time we have to mention. The same thing we can write in another way also. Has been, she has been diabetic since 2009. Both are present perfect, but we are writing in different way. So what is the difference you noticed in this situation? In the case of she has had hypertension, that is the noun or the name of the disease we are using since 2010. Then with the has been we are using she has been hypertensive since 2009. That here we are mentioning the state of being is the adjective form of the disease condition. That is the difference only here, but we both are correct. Okay. I think it's clear for you. Then another thing we are noticing here is regarding the recommends. What do you mean by recommends? The patient was on some treatment for a long time, like thyroxine, aspirin. If the patient is taking, as a nurse we know, it should be continued for her whole life. So in that case, the patient, suppose the patient is going to undergo some surgery. So prior to that, this medication, especially aspirin like that, because it can cause some bleeding during procedure. So we have to hold this medication for a few days. That means like 1 week prior, or even at least 2 to 3 days prior, the doctor will ask to hold that medication. Then what we are observing, the doctor will restart that medication postoperatively, like thyroxine and all. Even the next day we will restart. That is the one we are mentioning, like she was recommenced on aspirin. Otherwise, aspirin was recommenced on her. Or another word we can use, resumed, RESUMED. That is the same meaning, recommenced. Once it was just held for some time or period of time, then it was restarted. That is mentioning by recommenced or resumed. Okay. Then we have reached in the conclusion part. So usually we are writing, do not hesitate to contact me if you require further information or if you have any queries. Here what I want to mention is that if you write the independence clause at the beginning, no need to put comma after that. Here what is the independent clause? That is, do not hesitate to contact me. That is a independent clause. So in that time we can write, do not hesitate to contact me if you have any queries or if you require further information. So don't put comma that time. In regards to the dependent clause, you have to put comma. So for example, the dependent clause is here is if you require further information. So at that time you have to put comma after that. Then you can write, do not hesitate to contact me. So why it's like that? When we are talking about that one, while we are reading, we can understand. There is a pause after that. So in that way we can put a comma. If you require further information, comma, do not hesitate to contact me. So we reach the end of the letter. Then next is the doubt. Yours sincerely or yours faithfully, when we have to use these both. Okay, so let's see. If the reader's name is mentioned at the beginning and you are writing in the address part, you can write yours sincerely. So the Y of the yours should be capital and sincerely there should be small. Then don't forget to put the comma. And regarding the yours faithfully, if the name of the addresser or reader is not mentioned, you can use yours faithfully and don't forget to put comma there also. Okay, I think it's clear for you. If you need more clarification, just comment below the comment box. And if you find it's worth watching, please subscribe my channel if it is not yet done, and please share with your friends also so they can also get information from this video. Okay, and please enable the all bell icon to get the notification from all videos. Thank you. Bye.